When we see that they are having difficulty with their natural progression and development, we can expect that it's going to be visual problems. For the neurodiverse population, and I had tried to give that some additional thought, this is where it's so necessary. If it's if a child is premature, for instance, or if there's a history of developmental issues within the family, we like to see the child as early as infancy. The AOA had put together a wonderful program called Infant C, where a number of behavioral optometrists, developmental optometrists primarily, screen kids who are under 12 months of age. And that's brilliant because that's where we start to see the development occurs from birth.
Right.
And so when we see that they are having difficulty with their natural progression and development, we can expect that it's going to be visual problems.
Right.
And so if a child has cerebral palsy or if they have Downs, it's so important to be able to see them at an early stage so we can determine is there possible or potential problems that can lead to visual difficulties. We want to try to give as much an opportunity for these children to develop as normal as possible, to be able to have confidence or be able to use their visual system as competently as possible. That's going to allow them to have an independent life and not struggle. And so the neurodiverse population starts as early as infancy, can progress all the way up through adulthood for those individuals who suffer from stroke, who experience head injuries. We see a number within the teenage population where there is concussive injuries from sports. Same thing with adults. And so it's so essential to be able to see a behavioral optometrist because we can explore many of the facets that involve vision and to be able to help guide the treatment, whether it's through our offices or in conjunction with rehab facilities with other professionals like OTs, PTs, and speech therapists that can give a better quality of life to these individuals.